Good afternoon and welcome to United TV. My name is Kemal Erkan. It's our Bariatric Friday session. Dr. Irgau is with me. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you.
So thank you for being with us. Today we are going to discuss another topic. Again, we are repeating these topics and these are available in their own topic-specific playlist. People can actually see them, watch them directly from those playlist because we probably discussed some of them more than 7-8 times in the last 3 years, and every time there's some stuff a little bit different than the others. So if you feel like there's more support needed, this is a good way to get that extra support. So today we are going to discuss the multivitamin use pre and post bariatric surgery. So Dr. Irgau, if we can start from the pre-surgery, well, nutrition is important, but why is it more important in this case, and how we can actually help our patients to get them ready for the surgery?
Absolutely. Kemal, essentially, as you said, nutrition is at the heart of what we do, right? Because nutrition plays a big role in what has happened to our patients in terms of developing obesity and struggling with obesity most of their life. We provide bariatric surgery or weight loss surgery, and the number one goal is obviously to make some changes in their digestive tract so that their body becomes healthier. Their body knows how to lose weight, which is something that has escaped them obviously for years before coming to us. Mm-hmm. So, but it's not just about, how much patients eat, right? It is critically important for patients to understand nutrition, healthy nutrition. And we spend a great deal of time, obviously, preparing our patients before surgery for them to really become knowledgeable about nutrition. And when we talk about nutrition, Kemal, a lot of people may not clearly understand that there are two big categories that we consider. One is called macronutrients, and then the other one is called micronutrients. And apart from water, anything that we put down our mouths can be really defined in terms of these two categories. Clearly, macronutrients are the things we need in bigger quantity, right? Whether it's carbs, whether it's fats, or protein, all the foods that we eat will contain a combination of these, so hopefully in the right proportions, but those are the macronutrients, right? So understanding that is important. But there is another category of nutrients that is just as critically important, but its quantities are much, much smaller. And this is what we call the micronutrients. And of course, we're talking about vitamins and minerals, right? And we need them in much smaller quantities, really often in micrograms per day. But we will miss them dearly if we don't take them because they are critically important. In fact, if you look at the word vitamin, comes from the Latin vita, which means life, right? So they are life-giving substances. And if we don't have, there will be dire consequences to our health, even mortality, obviously, if it's not reversed, right? So these are important. They're important for anyone to conduct a healthy life. But why is it so much more critical for our bariatric patients? Because all the procedures that we undertake in the digestive tract to change is so that the person loses weight will bring about changes in which in the way in which the body actually handles the absorption of nutrients, both macronutrients and micronutrients. And in essence, the net outcome of these surgeries is going to be decreasing the body's ability to absorb these nutrients. And today, obviously, we're talking about the vitamins and micronutrients, right? So we need those things in small quantities. They are provided to us usually in small quantities. So if we create a change that will decrease the body's ability to absorb those small quantities, any reduction in the quantity that we take will have an impact in our ability to get those micronutrients. And obviously, we have to pay attention to that, whether we've done a sleeve gastrectomy, where we've changed the size of the stomach and obviously the ability of the stomach to make some changes to the micronutrients. And even more important, when we do something like gastric bypass or the duodenal switch, where we now not only are we making the stomach smaller, but we are rerouting the intestine. So a portion of the intestine doesn't come in contact with that the patient eats, right? Which will mean we're putting a handicap in their ability to absorb these things. So having patients understand this and then become compliant with the need to take vitamins and minerals for the rest of their life, to pay attention to that is critically important for our patients to stay healthy. And this is obviously something we emphasize because we don't want to be trading one illness for another, right? We've liberated patients from the ravages of obesity when we do weight loss surgery, so their blood pressure becomes normal or improves, so that their diabetes improves. These are all illnesses that we are getting rid of. But we cannot substitute them with malnutrition. We cannot substitute them with vitamin deficiency. If we have done that, we've done, a disservice to the patient. So that's why it is so important for our patients to understand that bariatric surgery and not taking vitamins do not go together, right? If you've had bariatric surgery, you have to pay attention to the vitamins you need and to the minerals you need. So to solve this problem, what we do is we teach our patients to take multivitamins that are appropriate for post-bariatric surgery. And generally, those bariatric surgery multivitamins will have additional doses of all the components that one finds in a multivitamin. In addition, we will ask our patients to take extra of certain vitamins, whether it's B12, vitamin D, folate. It will obviously depend on the individual. So the key message here is you cannot have bariatric surgery and then ignore the need of vitamins, because that will be dangerous. It will lead to many problems, including potentially some irreversible neurological problems like paralysis, memory loss, or others. And obviously, we don't want to go there. We want to make sure our patients understand the importance of taking multivitamins. How often? Every day. Often more than once a day, depending on their needs. So vitamins and minerals are critically important to the continued health of our bariatric patients.
So you take vitamins daily, right? I take vitamins daily, and you're not planning to have a bariatric surgery anytime soon. Hopefully, I'm not planning to have a bariatric surgery anytime soon. So, and you actually, I'm not going to say you forced me to, but you encouraged me to use the vitamins. That was maybe 2 years ago.
Yeah.
So this is important for everyone. So it's not just for this patients who are going through this process, but it's even more crucial because of the certain challenges that patients will have, preparation and other things. So it's important for everyone, but it's more important for the group that's going through this process. So I guess from the pre-surgery standpoint, it's more about understanding, starting the vitamins already, but knowing what it is, when to take, how to take, how much to take. Our nutritionists, our dietitians, they are there available, and prior to the surgery, they have around like 3 different nutrition sessions. So they do discuss these.
Yep.
And even after the surgery, they can still actually go through and ask those questions if there are any. So, but I guess vitamin use is even more important for post-surgery. So if we can actually just break that down to the level that I can understand why it is more important after surgery.
Absolutely. So as I said earlier on, obviously, all of us will need micronutrients, the vitamins, right? And also the minerals. We all need them. But this is even more important after bariatric surgery because the changes of bariatric surgery have decreased the body's ability to absorb, right? So one hopes that we will have access to fresh food and healthy foods, and that those foods will contain some of the vitamins and some of the minerals that we need, right? But with bariatric surgery, the patient's ability to eat a large quantity of a certain food is limited. And we want it to be limited because there are consequences in overeating. But limiting that also limits the availability of those vitamins, right? And of course, we live in a modern society, Kamal, where the vast majority of people will get their food from a store, right? Nobody goes out to the tree or to the garden or to the farm to get their food. Hopefully, some people may do, but the vast majority of us who live in this extremely complex modern society, we actually don't have time or opportunity to get our food directly from nature, right? We go to the store to get our foods, and the vast majority of the foods we get from the stores obviously will have decreased quantities of this because of the storage, because of the shelf life, and all those things, right? So we have to know that we have to go and buy a pill, a tablet that has all these different vitamins and minerals included in it. Modern, manufacturing industry has enabled that to us. So what we have to do is take those pills so that our vitamin levels are there, right? Now, when it comes to bariatric surgery, and I'm talking about all bariatric surgeries, even the band, the sleeve, of course, and more importantly, the bypass or duodenal switch, the changes in the digestive tract are so fundamental that there will be less room in the digestive tract to process all the foods and absorb them. So what we do is you provide larger quantities of these micronutrients in terms of the vitamins. Now, there is the teaching part, which is to teach the patients the importance of this and for them to understand. And then there is the compliance part, obviously, right? One has to, have a routine of getting up in the morning, take their vitamin, take their calcium, take their vitamin D, right? In midday, the same, or in the evening, the same, right? So how do we make sure that patients are actually taking those vitamins as they have been instructed? The last thing we want to do is wait for them to become ill and then figure out whether they're taking the vitamins or not. That would be too late. That would be too dangerous. So what we do is actually we encourage our patients to periodically follow up with us. And one of the things we will do during the follow-up will be blood tests, obviously. And part of the blood test, we're actually measuring specifically B12 level, thiamine level, folate level, vitamin D level, iron level, and in some cases, even other minerals like zinc and copper, we measure them to just make sure those are enough, right? The most common deficiency we see, Kamal, is iron deficiency, particularly in young women who are still having their periods and therefore losing blood on a monthly basis. But across the board in bariatric patients, iron deficiency is not. It's a fairly common thing, particularly patients who've had either the gastric bypass or the duodenal switch. So for those patients, we actually ask them to take a multivitamin that has iron as well in it, right? There are multivitamins that don't have added iron, and there are multivitamins that have iron. And we ask them to take something that has, 45 to 60 milligrams of iron with it so that they will be taking it periodically. When we do their blood test, if we find that their iron level is low, we add actually an iron supplement as well, which is a much bigger dose for them to take on a daily basis, right? And then obviously we want to make sure they have enough B12. We want to make sure that they have enough vitamin D as well. And our nutritionists, as you correctly said, in part of their teaching process will be to show patients exactly what type of multivitamins will have the substances that they are going to be requiring mostly, right? So the important message we want to give in this session is that one cannot have bariatric surgery and walk away and then forget about other commitments. Of course, we talk about the commitment of healthy eating and also of regular exercise, but it is no less important to also commit to take multivitamins because, as I said, in the long term, the person could have problems. They could have problems with hair loss. They could have problems with their bones becoming too weak. They could have problems with fatigue, memory loss, paralysis, and even worse consequences as well, right? So this is best avoided by taking extra of these micronutrients on a daily basis. So taking vitamin is part and parcel of the commitment a person needs to make after they've had bariatric surgery. And that's why our relationship with our patients does not end with the surgery. It's ongoing because the changes that the surgery has brought have an impact on their needs from a nutritional point of view. And we have to be there to coach them, to help them monitor it, and to encourage them, obviously, with this compliance.
So, Dr. Gal, I know we tell our patients, not for our bariatric patients, for any patient, they need to get their blood work minimum once a year. In the case for our patients who are going through the bariatric surgery, do they need to get their blood work more often than once a year, like just every 6 months, or is it okay to do
Yes.
it once a year?
Yeah, in our protocol, we do it every 6 months. Come on.
Every 6 months.
Now, that is something that we do particularly in the first 1 or 2 years. After that, we can transition to yearly, particularly if we see that somebody has gotten it. And the vast majority of our patients do. Essentially, I'm happy to say that they understand this commitment, right? But at the beginning, until they are, until we're comfortable that they're taking every micronutrient that they need, we do those tests even more frequently. Now, this is even more important, obviously, in a person who's having some sickness. For instance, if they're having nausea or throwing up, certain vitamins can be depleted much more quickly from their system, and it's important for us to, provide it to them. A classic example of this is thiamine or vitamin B1. If a person who is throwing up, for instance, can deplete this vitamin very quickly. But the interesting thing, Kamal, is that once they become deficient of this B1, the vitamin B1 exacerbates the vomiting. It becomes the cause of the vomiting. So they can enter into a vicious cycle where really they can get in trouble, right? So one of the things we do, for instance, if a patient who's had bariatric surgery, for whatever reason, presents at an emergency room, and they require hydration, we ask the emergency room physicians to give those patients actually a IV fluid bag that has vitamin in it. We call it the banana bag, essentially. And that is because we know that our patients are always at risk for becoming deficient, particularly if they are sick.
So, in kind of like a summary, so there are changes, digestive tract changes that we have. So this is going to make things a little bit challenging for our patients. So we want to make sure that we prepare them for better outcomes. So preventing deficiencies ahead of time. I think one of the really important one is supporting healing and recovery process. That's gonna, if your body has the right minerals in it, so then it will be able to fight certain changes, and it will be, maybe fight is not the right word, it will be able to support itself better. So, and this is because of that, optimizing our outcome for the surgery is going to be important, but most importantly, maybe long-term longevity of the outcome. How can we actually keep this on a regular basis, ongoing, so you don't have to go back to square one a couple of years from now just because you have some good outcome. So this is a good, these are good habits to pick up early on. That's why we start pre-surgery, so then they can actually better prepare for the post-surgery time. Now, is one better than, or more important, not better, but is one more important than the other one in terms of which vitamin, or more crucial, Dr. Ergau?
Absolutely not, Kamal. I think that's all the vitamins are essential for a healthy life. So you could argue that perhaps certain deficiencies will show themselves up more quickly than others. It is possible. Or we have the ability to store certain vitamins at higher storage levels in our body than others. But really, all of them are equally important, Kamal. The key is, obviously, we need them at very small quantities, very, very tiny. And we talk about micro levels, but essential. So missing them has huge consequences. And sometimes it's okay to take, extra of those doses. I find, patients coming in, for instance, and they will have been taking, B12, for instance, at higher doses. And then, and then they come and I see the levels and I tell them, of course, I don't want to discourage you from taking this multivitamin, but you don't need these higher doses. So sometimes people go overboard and take higher doses. In the vast majority of situations, it's not going to hurt them, right? But it is important for them to know that it is better to take too much rather than not take them at all. So their compliance is very important. But the way for us to figure this out is, if we are seeing them on a regular basis, if we are doing blood tests, right? Sometimes I worry when I don't see patients for years, and I see them, years later. Very often I am gratified to notice that they have been compliant during all this period, or their primary care doctors, knowing their history, have been following them up and making sure that they have been taking them. But sometimes, occasionally, we see patients come on that haven't been seen for years, and they haven't taken a lot of their nutrients, and you can see it in their complexity, in terms of how healthy their skin is, how healthy their nails are, their hair loss, and all these things that tell us the story right there and then. And it's critically important for us to really emphasize at that time how important it is for them to take their vitamins and micronutrients and minerals.
And I guess for them to kind of just remember what to do, like those little medication boxes, like the weekly ones are, well, I use it. So you fill them out. That is on the countertop. You go there first thing in the morning, you take it, and done. So you don't have to remember.
Yes.
Put it right in the fridge so that you know that you'll see it right away. So like having the days does help. But I want people to really kind of hear us out. This is not because you are going through the surgery. That's why I try to give a lot of examples from what we do day to day. Like this week, there were a couple of days where I wasn't able to put 10,000 steps. So then I need to be aware of that. And I need to actually make sure that I'm back to normal next day or the day after. And I understand why, I'm not able to make my schedule changes based on, the activity level. So we make those planning regardless of what type of surgery we are going through, or if we are not going through any surgery, or if you don't have morbid obesity. We are already doing all these. So that needs to be kind of like the mindset. So then you are not feeling like, oh, I'm doing this because. No, you are doing it because you should have been doing it anyway.
Right.
That's the key that we want people to understand. So, and also, like, many people don't really probably understand how important the lab work is. So that's why I was asking that earlier. So even going through the program, how many people we actually diagnose their diabetes, their hemoglobin, in some cases their GFR level, and with kidney issues, the TSH for the thyroid level. So, and they were probably having symptoms, but they didn't bother to have a test, and then they didn't know what was wrong with them. They just didn't think that they were maybe thinking it was just psychological. No, it's like your body's telling you something, and it does communicate through those blood work results in many cases, because in medicine we are kind of limited without those blood work, right? So that's the power, that's the tool that we use. So get your blood work in a timely manner, look at your values and see what is missing. Discuss those with the nutritionists and surgeons as well. So this is the key for a good outcome. And I mentioned this, I believe, not in the multivitamin session, but one of the patient perspective. One of our people in Turkey who works with us had bariatric surgery, and when I was there in November, he was having difficulties, complications, and he lost a lot of weight and everything. And then, first thing I asked him, like, which vitamins he was taking, so I was gonna change his vitamin according to what you would tell me. And he's like, I don't take any. I'm like, what? Like, how is that possible? It starts from there. So like someone with a good outcome doesn't think of, hey, we need to make this long term. So it's not about just today. And just like I lost, let's say, 90 pounds. Oh, I'm okay. No, you're not, because now you are back to normal. Now we need to keep things in the normal ranges. So
Yeah.
that's why we are actually emphasizing this as much as we can. So it's one of those things that you cannot ignore,
Right.
because it's extremely important for the better outcome and better experience overall we have to go through. So anything you would like to add, Dr. Ergau?
Oh, well, I mean, some people may worry that, getting bariatric surgery will mean that they have to really commit themselves to take this vitamins and minerals, for the rest of their life. Well, as you said earlier on, clearly, if you live in a modern society like ours, you have to take multivitamins anyway, because you don't have access to fresh food that will provide you those micronutrients in adequate levels, right? So that's not going to change, whether you have bariatric surgery or not. But what will change is obviously the doses will be different, and then we will obviously monitor as well to make sure that that person is, current with their vitamins, essentially. There is a difference clearly between something like the gastric sleeve and the gastric bypass in terms of how much of these minerals one would need. And that is because the sleeve is a procedure where only the stomach is operated on, right? The intestine, its ability to absorb the full length of the intestine is left in its natural state. That's the gastric sleeve. With gastric bypass, on the other hand, we do make changes to the intestine, which are drastic in terms of the body's ability to interact with nutrients, right? Because we bypass that early portion of the small intestine, which is the most active in terms of its ability to absorb. Because we've done that, it becomes even more critical for a person to be taking multivitamins in adequate quantities. So it's critical for all bariatric surgery patients to take multivitamins, but it is even more critical for people who had a bypass operation like gastric bypass or duodenal switch, where the changes in the intestine are so drastic that they cannot, in practice, supplement themselves of vitamins and minerals just from the food they eat.
One other thing that I want to mention before we close for today, Dr. Ergau, this issue of fresh food and access to fresh food, and I think many of us, we kind of lost our ability to understand what that means anymore. But the best way to overcome that problem is easy. So you don't need to have a big yard or anything. You just need to you can do it in a pot, or you can do it in a very small, if you have a small yard, you can put boxes. Try. I'm not saying that you can get everything from there, but try to just plant a tomato or cucumber or
Yep.
zucchini. And they're very simple, it's almost effortless. But the reason you need to try is to kind of get that feeling of the fresh
Yep.
versus not fresh. So I have that for several years now. And the things we get from the market, the tomato, it's like they're like red and everything looks good. You don't smell anything, you don't taste much. When you get the same tomato from the garden, number one, you have a connection. Psychologically, mentally, you are connected to it because there's that really good, pleasant smell of it. Then once you have it, it's a different taste. So that's what's missing from the freshness of the fresh food. So that has a lot to do with, it doesn't matter how much we eat. It's the quality of what we eat, and what the transition that thing went through makes it less value. So that's why these supports are needed for today's people. So
Absolutely.
Absolutely. All right. Well, thank you so much again for joining
Thank
us.
you.
This is always it's a pleasure to have these. I know a lot of our patients are benefiting from these events because I now get requests for or they're asking when the next one is. Are we going to do it live, or are we going to play a video? So I know that there's a good number of people who are benefiting from this. So thank you for making this possible and being available for us.
Of course. Thank you.
Thank you.
Yep. Bye.